I want to start by commending the work of campaigners and activists who have worked tirelessly to ensure that we have international awareness on HIV and AIDS. The legacy of racism surrounding the AIDS pandemic casts a long and enduring shadow for communities like mine in Lambeth and indeed across Africa and the Caribbean. And whilst the impact of the virus has evolved, and so too has our understanding of it, the legacy of the racist attitudes around AIDS has had continued consequences for black communities in the healthcare system. HIV-related racism and stigma increases vulnerability to infection in black communities, and those who are HIV positive are less likely to come forward to be tested or access treatment and health services. Last year, more than 1 in 3 HIV diagnoses in Lambeth were classified as late, meaning that the immune system had already suffered damage. And across England, 44% of diagnoses are late, and women are 51% more likely to receive such delayed diagnoses. We all know that early detection saves lives, and offering effective treatment that ensures that those living with HIV can lead long and healthy lives and not passed on the virus once it's suppressed. And those who are not infected are still at high risk because HIV stigma can prevent people from accessing information and education. We also know that cultural taboos linked to sex and sexually transmitted diseases in black communities can also impact on people's access to HIV prevention and education, and thus directly increases the vulnerability to HIV infection of those who are not infected. Racist assumptions around HIV and AIDS have also had consequences in other areas of the healthcare system. As recently as 2021, the NHS had a discriminatory blood donation ban on black donors due to flawed science around HIV. Now, this had a direct impact on sickle cell sufferers, an illness that predominantly impacts the black community, and treatment which is dependent on blood transfusions, particularly from a rare blood group such as the RO group, which is common in black people. The legacy of these rules has resulted in reluctance amongst the black community to come forward and donate blood. And this is why I commend the work done by organisations like the Terence Higgins Trust, who made a concerted effort to combat outdated and discriminatory policies and all the damage that they cause. I couldn't allow this opportunity to pass without mentioning the new Brixton Blood Donation Centre in my constituency in Brixton, which is opening in a few weeks. And I'd like to extend an invitation to the Minister and all members, actually, to come and visit the new clinic and to open their veins and donate. And also, it's so important that we challenge the misgivings around blood donations, so encourage people to donate. Ending HIV, new HIV cases, is not just a medical issue, it's a social justice issue. And we have to challenge the racism and discrimination that prevents individuals from accessing care, education and support.